Namaste everybody. Today I will demonstrate some series, especially for people who are going through some hip related issues. So one of the things you may want to do is reduce extensive practice if you have hip issues, especially the practice which requires you to standing, running, and those kind of things, right? So standing postures you can kind of slow down and be careful about. So what I would be demonstrating is mostly the postures and sequence which is being sitting down. So all right, so let's see the sequence of postures you can do if you are dealing with hip related issues. So we'll go to the back. So the first thing we'll start with Malasana. So you start standing, that's fine. Then you can slowly go into Malasana. If you can go Malasana with standing, that's good. If not, you can sit down and then get into Malasana. So one of the ways you can get to Malasana, I'll go a little bit back so you guys can see me. So this is Malasana. You try to keep your elbows and push your knees back, and that tries to open up the inner thighs and hips. Okay, you can stay in Malasana, and it also opens up your lower back, which is very good. Especially Malasana would be good also for people who are dealing with lower back issues. So in Malasana, some people are able to do this posture really easy. Some may have difficulty, so you may wanna try out from alternatives. If you're not doing able to Namaskar, you can put your arms on the knees, right? So once you're in Malasana, the other thing you can do it, if you are able to do that, is basically get your Namaskar down on the floor and touch your forehead on the palms. Now as you become advanced, you can slowly go ahead and touch your forehead on the floor. This is to kind of try to open up the body a little bit more, but this is really optional. As long as you can do Malasana, that's good. So after doing Malasana, you go sit down, and you will do all this posture at least 30 seconds to 1 minute, right? I'm gonna go a little bit faster just so that we can get to the series quickly. So this is butterfly. Most of you know. Try to get your feet closer, your heels very close to your body, as close as possible. If possible, even touch it. If it is not, you can keep it away if you have difficulty on getting there, right? And then you hold it, pull it towards you, try to open up the lower back and move your knees. This is a great posture, good hip opener, especially for the people who are dealing with hip issues. This is a great posture to do, is the butterfly. And you can flap the butterfly wings faster or slower. If you are having a lot of inflammation in hips, you may want to go really slow. Okay, be careful. You know your body well than anybody else. So try to use these postures and apply that to your body conditions. Okay, once you have done a butterfly, you can add on to it again, very similar to how we did in Malasana, is basically trying to touch your forehead to the toes. Again, this is optional. You can continue doing butterfly. So forehead to the toes, and then you can get your arms getting rested. This helps opening up the spine, relaxing your body. It's a very humble posture. So only if you are able to do, you can push your knees against and then try to keep your spine straight as much as possible. Stomach muscle in. So don't try this if you are having a lot of excruciating pain and things like that. Just continue and do butterfly, gently do butterfly. If you have a lot of inflammation, just do butterfly, don't do the other ones. Alright, now that we are over here, try to give yourself a nice hug, just trying to get the legs a little bit in the normal position. And over here, what I would do is try to get into Naukasana. So Naukasana will help you to build the core strength, right? So Naukasana is keeping your arms up, and your toes can be at the line of your forehead, and then you stay over here. You can count 20, 10 seconds, 30 seconds, 1 minute, be in Naukasana. Once you're done with Naukasana, give yourself a hug. Alright, now we'll lay down. So from here, you lay down on the floor. Once you lay down on the floor, you'll do a bridge, and the way that you bridge is, you open up your feet a little bit, okay? You can keep your palms either facing up or down, and then you lift your hips up. This is a great posture, especially for people who are dealing with hip issues and the lower back, lifting your hips up. Make sure you're contracting your hip, just trying to open up. There is a little bit of a compression on the upper spine. Since the upper spine is laying down, that is your neck is laying down on the floor, and then hips goes down. Try to do this repetition 3 to 5 times maybe, or even more. Exhale, breathing. Inhale, come up. Exhale. Alright, stay over here. That's good. So once you are done with the bridge, what we will do now is to get into Pavanmukhtasana. Good posture to open up your hips, specifically for the people who are dealing with hip issues. Try to press your right thigh bicep on the right side of the stomach, okay, and then pull it. You have to use your arm strength. You open up your hips nicely. It gives a nice compression on the stomach. At the same time, it also opens up your hips nicely. And do that gently if you have a lot of inflammation on the hips, okay? So right leg goes down, do the left leg, the other leg, press it against. Good one for hip opening. And then lift your both legs up. Lift yourself up and grab your elbows across. And then press your both thigh biceps on the stomach. Feet can be relaxed. Alright, once you are done with Pavanmukhtasana, you can get your feet on the floor just like this. And then open up your arms nice and wide. Great posture for the hips. Okay, try to get your knees toward the left side of the room and then look to the right side. Gently do that. Try to give a twist to the hips, at the same time twisting your spine as well. So good for the lower back and hips. So many of these postures are good for the lower spine and the hips. They are all connected together, right? Stomach muscle can be relaxed. Rest of the body is tricep relaxed. The more you relax, the more you can go deeper. The other way, look to the left side and the knees fall to the right side. Okay, so this is some sort of twisting postures. So we'll continue to do a little bit more twisting. We can kind of get your legs started up to the front. Try to cross your legs, wrap your arms from behind and become like a banana. So go towards the left side. So elbows go to the left side. Don't move your spine too much. Just legs and your arms. Okay, and then that gives a stretching on the right side of the body. So again, a twisting posture. You become like a banana. Do the other side. Now the elbows goes to the right. Try to get the leg already towards the right. So the spine remains there. So giving a twist. It's a good one for the spine and the hips. If you do it the right way. It might take some time just to kind of get a hang of banana posture. Alright, come out of banana. Right. Now we are over here. Now if you feel that you want to work a little bit on the core, this is a good time. So try to work on the core by lifting yourself up. 1, 2, 3, 4, 5, 6, 7, 8, 9, and the last one. Come on, all touch your forehead to the knee. Alright, now we'll do a reverse tabletop. So you are over here. Try to get your palms, fingers facing backwards. Okay, get your legs a little bit forward. Lift your hips up a bit. This is great for hips and the spine as well. So that is the reverse tabletop. Once you get into the reverse tabletop, it is optional, especially for the folks who are able to do that, do a wheel. To do the wheel, the palms goes back like that, alright? And then you lift your hips up, feet remains flat. You can lift your heels up as well, but eventually you want to get your heels down. Okay, if you are able to do wheel, alright? Get to Naukasana and come back out. Alright, now that we have done wheel, now we'll go into Vajrasana. Vajrasana is a good posture for your hips and your lower back. It aligns your spine very nicely. Bring back for you. Okay, now arms up. Ardha Kurmasana. Good posture. Once you're done with Ardha Kurmasana, so in Ardha Kurmasana, the important thing is your wrist has to be up, only little baby finger touching, right? Scapula coming out. Alright, now come back out using your core strength. Once you're out, try to do Supra Vajrasana. In Supra Vajrasana, you open up your feet, knees are closer. If you have a lot of tension on the knees or ankle, you can open up your knees a little bit, but try to keep your feet open exactly the same 6 inches. Elbows goes down. You can stay over here if you like, and if you feel that you can go back. Go all the way back until head touches and then the neck goes flat. Try to wrap your arms from behind, chin towards your chest. Some of the postures you may not be able to see. Send me a message personally and I will I will demonstrate it specifically on some of the postures you are not able to follow. Come back out with your knees on the floor and get back to the Vajrasana. Once you're Vajrasana, now we will do some of this posture. We will get into the real tabletop. Okay, try to open up your knees. And from the real tabletop, you can be over here. Good posture to align your spine nicely. We'll do cat cow. Okay, inhale, breathing, look up. Exhale, look down. Inhale, look up. Exhale, look down. Inhale, look up. Exhale, look up. See how you do that? When you look down, you suck your stomach in, lift your hips up. Okay. When you look up, there is a little bit of bending of the spine. Cat, cow. And then in the next one, when you do that, when you look down, you can go into down dog. Down dog is a good posture to open up your hips. At the same time, it's a great posture for your lower back. So I would highly recommend people having hip issues to do downward dog if possible. So you don't have to do downward dog from standing up. You can do it from the Vajrasana, coming to tabletop and then doing the down dog. And then you go into tabletop back again. Look up. Cow, cat, dog, cow, cat, dog, cow, cat, dog. All the animals helping you out. Alright, now get into the tabletop. Once you're in tabletop, get back into Vajrasana. So that concludes all the series. Do Kapalbhati, great for you. Only focus on exhales, inhale, happen automatically. Do it at least 50 times, 100 times. Try to do a little bit faster maybe. And then that concludes your series. Try to do this every day. You will see a lot of improvements in your lower back and also improvements in your hip area. I hope this will help you. If you have any questions, drop me a message. Namaste.